Case 4 is a common plantar heel pain presentation with risk factors including occupational demands, foot type, and work-specific footwear. Patient 4 is a male office worker with a neutral foot type and plantar heel pain. He presents as a 45-year-old, around 82 kilos, with an active and healthy lifestyle and works long hours up and down on his feet in dress shoes. He has a flexible neutral foot and passes the lunge and jack test for sagittal plane function. He's had a painful heel on and off for 12 months. It's worse first thing in the morning and later in the afternoons. This patient responded positively with fascial support strapping. Let's go through the pathway for orthotic prescription. Step 1. Let's pick the DOLA Pro style for this patient. His work shoes don't have a removable insole, so a 3/4 length device is indicated, and due to the reduced amount of available space, so we'll go with the DOLA Pro 3/4 length. And then based on his body weight, we'll use a medium density Pro 80. Step 2. Let's look at his foot type to see what prescription we need to add to the DOLA Pro 3/4 shell. A neutral foot usually doesn't require much further adjustment of orthotic reaction force, as the DOLA Pro's standard features provide sufficient orthotic dose. The fully reinforced medial arch support of the DOLA Pro will reduce the load and strain on the fascia during loading, stance, and propulsion. Step 3. Now we need to look at the pathology or tissue stress and see if there's any further prescription required there. With plantar fasciitis, most prescriptions will include adding extra cushioning to reduce the load. In this case, the space in the shoe is at a premium, so we've gone for a pour-on heel pad to increase the cushioning on the heel and without taking up too much space in the shoe. Step 4. Due to his work shoes, we need a thin, durable and luxurious top cover with a high quality look and feel, so we've chosen the DuraFit top cover. The aim of this orthotic is to reduce the load and strain on the fascia, provide extra cushioning and a luxurious top cover, all whilst being able to fit into a men's business shoe. So let's take a look at how we're going to make this in clinic. First we take the DOLA Pro 3/4 and a self-adhesive heel pad. We just place this in the center of the heel. So these are available in a few different sizes depending on the heel cup size. So you just get the one that's going to be the closest fit. And then we're just going to glue the undersurface of the DuraFit top cover and the top surface of the Pro 3/4 shell. This is just done with the self-adhesive contact adhesive, and then we can spot heat it to activate the glue to get a better adhesion as well. Then we're just going to place the top cover on top. Taking a bit of time with this, we want to make sure that we get really nice even coverage and the pressure's nice and even, especially around the heel. We want to start from the distal end and work back into the heel cup to get a nice finish with the DuraFit on top of the shell. In this video here, you can actually see how we haven't trimmed the DuraFit top cover. We're just using the actual grinder to trim it as well, so that can save you a little bit of time. One of the good benefits of covering with the DuraFit material, nice and strong, so you can actually get a nice grind out of that without having to trim it first. So just little tips to make you save a little bit of time. And then we're going to fit it into the business shoes. So good thing about the Pro is how nicely it fits into the heel, just like that.